Did you know that the hospital is now withdrawing the funding?
I was told in a couple of days, but it seems silly to me that they should do that.
It says something when a patient from his hospice bed says he wants to talk. But that was...
Yeah, so this one is interesting. I'm the CEO of Precious Hospice. This actually is in the UK. This actually is not in America, but I'm going to be honest. As you watch this story, pay attention, because this is actually what should be happening to some degree. Not like this, but ahead of time, we should be maneuvering and getting patients out of the hospital before they pass. The notion to let patients pass in the hospital with the hospice in place, to me, it feels like the hospice is just paying the hospital some money for that bed. I could be wrong, but ideally it makes no sense, and it's not in most cases in the best interest of the patient at all.
But that was the strength of feeling in the building today, as news of funding cuts trickled through.
Came here and they've been absolutely perfect.
What's perfect about it?
Yeah, they couldn't be better.
Did you know that the hospital is now withdrawing the funding?
I was told in a couple of days, but it seems silly to me that they should do that.
But they, being Cambridge University Hospitals, has done this, confirming that they are withdrawing their £829,000 annual contract in 6 months' time. And
so I'm still say, so the way they have their program set up there is actually much better than probably what it is here. Over there, they're paying the hospice company, or so that's the way I receive it. Ideally here, I don't think they work like that. I can't not see an American hospital paying a hospice company, but I can see a hospice company trying to get into a hospital by paying the hospital a per day usage for each bed. Does that make sense?
In the American system, yeah, but isn't it all one system in the UK?
What do you mean?
Like their national health is all one integrated system. So it's not like the hospice section is going to need to pay the hospital section for that person. I mean, I don't know exactly.
They're still separate companies though, if I'm not mistaken.
I think it's all public. I don't think it's like the Japanese model of universal health care where it's private companies that get paid by the government. I think it's all a government organization. It's kind of like everybody's on Medicare. It'd be like if Medicare was paying Medicare for a Medicare bed.
The only reason why I guess it could be, but then there'd be no reason for the contract. If it's all one government entity, there'd be no reason for a contract.
That's true.
So that contract to me is explicitly stating like the hospital is paying this amount to a hospice to facilitate this relationship, where in America, the hospice pays the hospital to keep other hospices out as best they can, which makes it, insane to me as a hospice owner. And more importantly, forget the hospice part, as a owner, it makes it terrible for the American people and patient choice.